I am Dr. G. V Divakar. Normally, retinal detachment occurs in patients who are having high myopia and with fluid vitreous. And if the retina, there are some holes or some breaks are there. Normally, floaters are the first sign of detachment. They see some dark spots or some specks or threads or right going in front of the eyes, moving in front of the eyes. Then flashes of light, they may see floaters and flashes are most common. They see flashes of light of sudden bursts of brightness in one of the eyes. Then curtain-like shadow can occur. They experience a shadow or a veil falling from the upper part to the lower part, covering the eyes. And blurring of vision will be there. They experience blurring of vision or disturbed vision. Loss of peripheral vision. Sometimes central part they will be able to see, the peripheral areas they will not be able to see. These are the common symptoms of retinal detachment. Some people may not experience any of these symptoms, or the symptoms may be subtle. The severity of the symptoms depends on how much of the retina has detached. If the macula or central part of the retina is detached, they become completely blinded. Vision will deteriorate too much. To check the retinal detachment at home, you can try the hamster grit test. Wear your glasses for reading, cover one eye, and you can look directly into the central part of the central dot with the uncovered eye. Check if the grid looks straight or the lines are bent or blurry or wavy or dark and are missing. If you suspect retinal detachment, you should seek medical advice immediately, because detachment has to be treated as early as possible, because if you leave it for a longer time, even up to if you do surgery, the detachment correction is quite difficult. Wateries are known as epiphora can have many causes, including blocked tear ducts. Tear ducts are on the nasal side, nasolacrimal ducts are there. Tear duct produced by the tear glands above the eyes. Tears are produced by the tear glands above the eyes, drain into the eyes, and tear ducts are at the corners of the eye, like it's called nasolacrimal duct, connecting the eyes to the nose. A blockage of the tear duct can cause watering eyes. It's called dacryocystitis. Or there will be some small opening in the eyes will be there called puncta. It can get blocked due to some foreign bodies or some swellings. So it can also cause watery eyes. So exogenous allergens or some irritants can also cause watery eyes, like foreign particle falling into the eyes. So dry eye also can cause watering when the eyes don't have enough lubrication. They can become constantly watery. And foreign objects falling into the eyes like dirt, grit, or eyelashes coming into the eyes can cause watering. Some eye problems like inward or outward turning of the eyelid margins, called as ectropion or entropion, can also cause watery eyes. So this is called reflex lacrimation. One due to the blockage of the duct is called epiphora. One due to irritation from outside is called lacrimation. So eye infections also can cause pink eyes like conjunctivitis, or corneal damage or keratitis can also cause watering in the eyes. Weather conditions like wind, sun, too much cold, or dust or bright light can cause watering in the eyes. Treatment of watering eyes depends on the cause. For example, if it is due to dry eye, artificial tears can be used. If it is due to blockage of the nasolacrimal duct, some surgical procedures can be done, like dacryocystitis or some other canal can be passed from the nasolacrimal duct opening or the punctum into the nose. These are done by ophthalmic surgeons or ENT surgeons. And sometimes the blockage is too temporary. It can be cured by antibiotic eye drops applying to the eyes. And if the blockage is due to some problem in the nose due to allergic rhinitis, drugs can be used to treat that, or surgery has to be done to correct the ENT problem. Or if the dry eye is the cause, then the oil lubricants to help the watering and warm compresses can be helpful. To help the watering, in most cases, watery eyes are temporary and will get better. However, if you notice any abnormal watering or eye irritation, you should visit the eye doctor, where they will do some surgical procedures, as I told earlier. It can be surgery connecting the eyes, lacrimal sac in the eyes to the nose, that can be done, called dacryocystitis.